In the heart of Alabama, between 1932 and 1972, hundreds of black men were deceived into participating in a government-run medical experiment. They were promised free medical care, but instead were subjected to a cruel and unethical study. For 40 years, these men suffered, unaware that they were part of an experiment that denied them treatment for syphilis, a disease that would ravage their bodies and claim their lives. This is the story of the Tuskegee Syphilis Study, one of America's most infamous violations of medical ethics. It is a story of deception, suffering, and the fight for justice. It is a story that changed medical research forever. To understand how this tragedy unfolded, we must first understand the world of medicine in the early 20th century. For Black Americans, access to healthcare was limited, especially in the segregated South. Hospitals routinely refused to treat black patients, and racist medical beliefs led doctors to assume that black bodies responded differently to disease. Some even believed that black men were naturally more promiscuous, contributing to the spread of venereal diseases like syphilis. At the time, syphilis was a major public health crisis. It caused blindness, organ failure, and even death if left untreated. The U.S. Public Health Service wanted to understand the long-term effects of untreated syphilis. But rather than conducting an ethical study, they saw an opportunity in Tuskegee, Alabama. In 1932, the PHS launched what was originally called the Tuskegee Study of Untreated Syphilis in the Negro Male. Their goal was simple: observe how syphilis progressed in black men if left untreated. They recruited 600 black men, 399 with syphilis and 201 without. These men were poor sharecroppers, many of whom had never received medical care before. The government doctors told them they had bad blood, a vague term used locally to describe various illnesses. In reality, they had syphilis, but they were never informed of their true condition. Instead of receiving treatment, they were given placebos, such as vitamins and ineffective medicines. Even after penicillin became the standard cure for syphilis in the 1940s, these men were deliberately denied access to the life-saving drug. The men were never asked for their informed consent. They were lured with promises of free medical care, meals, and even burial stipends for their families. Local black nurses and doctors, trusting the legitimacy of the program, unknowingly helped facilitate the study. These medical professionals carried out blood tests and spinal taps, believing they were assisting with a noble cause. But the truth was far more sinister. These men were not being treated. They were being studied like lab rats. As years turned into decades, many of the participants suffered severe symptoms. Their wives contracted syphilis. Their children were born with congenital syphilis. Generations of black families were affected, all while the government silently documented their suffering. Over the years, several doctors raised concerns about the ethics of the study. However, the PHS defended the experiment, claiming that it provided valuable scientific data. The study persisted through World War II, the Civil Rights Movement, and the discovery of antibiotics, all without intervention. For 40 years, this medical atrocity continued, hidden in plain sight. In the 1960s, a young epidemiologist named Peter Buxtun joined the U.S. Public Health Service. While reviewing case files, he stumbled upon the shocking details of the Tuskegee study. Horrified, Buxtun raised concerns with his superiors only to be ignored. For years, he fought to bring the truth to light, but the government refused to act. Finally, in 1972, he leaked the study's details to the press. The Associated Press ran the story, exposing the study to the American public. The reaction was immediate and furious. The public demanded accountability. Congressional hearings were held, and the experiment was officially shut down. The surviving participants were given medical care, but for many, it was too late. In 1974, the U.S. government reached a $10 million settlement with the victims and their families. However, no one was ever criminally charged for the atrocities committed. Participants must give informed consent. 2. Beneficence. Research must minimize harm and maximize benefits. 3. Justice. Studies must not unfairly target vulnerable populations. These reforms laid the foundation for modern medical ethics, ensuring that what happened in Tuskegee would never happen again. Yet despite these reforms, it wasn't until 1997, 25 years after the study was exposed, that the U.S. government issued a formal apology. Standing before the survivors and their families, President Bill Clinton acknowledged the grave injustice they endured. What the United States government did was shameful, and I'm sorry. For the remaining survivors, it was a long overdue recognition of their suffering.
We cannot make amends, and we cannot go forward. So today, America does remember the hundreds of men used in research without their knowledge and consent. We remember them and their family members. Men who were poor and African American, without resources and with few alternatives. They believed they had found hope when they were offered free medical care by the United States Public Health Service. They were betrayed. Medical people are supposed to help when we need care, but even once a cure was discovered, they were denied help, and they were lied to by their government. Our government is supposed to protect the rights of its citizens. Their rights were trampled upon. 40 years, hundreds of men betrayed, along with their wives and children, along with a community in Macon County, Alabama, the city of Tuskegee, the fine university there, and the larger African American community. The United States government did something that was wrong, deeply, profoundly, morally wrong. It was an outrage to our commitment to integrity and equality for all our citizens. To the survivors, to the wives and family members, the children and the grandchildren, I say what you know. No power on earth can give you back the lives lost, the pain suffered, the years of internal torment and anguish. What was done cannot be undone, but we can end the silence. We can stop turning our heads away. We can look at you in the eye and finally say, on behalf of the American people, what the United States government did was shameful, and I am sorry.
The Tuskegee Syphilis Study remains one of the darkest chapters in American medical history. It was a stark reminder of the dangers of unchecked government power, racism in medicine, and the consequences of sacrificing ethics for science. Even today, the study's legacy lingers. Many Black Americans continue to distrust the medical system, a distrust rooted in real historical trauma. As we reflect on this story, we must ask, how do we ensure that the mistakes of the past never happen again? Because history teaches us that justice is not just about acknowledging the past, it is about protecting the future.